Hi, this is Andy Stansfield with Stansfield Health and Life. And today I'll be talking to you a little bit about 2020 Medicare prescription drug plans. Specifically, we're going to be talking about the different stages that are incorporated in all prescription drug plans associated with Medicare, including what in the world that darn donut hole is all about. So to make it simple, basically what the insurance company is doing is they are keeping track of the money that's being spent on medications. If you can imagine the medications that you might be taking, you'll probably know that the cost that you are paying for most of those medications is not the full cost of that medication. In other words, you're paying some and the insurance company is also paying some towards the full amount. In this example, we're going to look at a drug that costs about $100 on a monthly basis. Full cost of that drug. You may not be spending that amount right now, but between you and the insurance company, $100 is being spent on the medication on a monthly basis. So all drug plans start with this. They start by saying, okay, the first amount of money that's going to be spent on medications will go towards a deductible, much like a car insurance deductible. The drug deductible is an amount of money that you, the insured, comes out of pocket to pay for your medications up to a certain point. In 2020, deductibles on plans can range anywhere from $0 to $435. After that, we go to something called stage 2. When that deductible is met, whether it's 0 or up to $435, you move on to stage 2 after that is met, and that is called the initial coverage stage. Initial coverage. During this stage, you are going to be, as the insured, are going to be responsible for paying co-pays for your medications. Those co-pays are based on how the insurance company ranks the particular drug that you are taking. They rank them on what are called tiers, either a tier 1, a tier 2, all the way up to a tier 5. Generally, the more expensive the medication, the higher tier it's going to be. And they will assign a copay to those tiers. For instance, some drug plans will say a tier 1 drug might be $4. A tier 2 drug might be $10. A tier 3 may be $47, and so on and so forth, all the way up until the tier 5. And that would be the cost that you are spending on that medication. So just to go back, the deductible phase, if that drug is normally a $100 drug retail cost, then essentially the first 4 times you fill that drug, you'll be paying $100 for that time. And if you're on a $435 deductible, that full $100 will be coming out of your pocket. Once you reach that full deductible and you move on to the tier system, then you'll have to see what they rank this $100 drug as based on your particular plan. In this case, let's say they rank it as a tier 2. That would mean that your new payment is $10 for that monthly amount for that fill of that medication for the month. So remember when I said the insurance company is tracking all the money that's being spent towards that medication. If we're looking at our $100 drug there, then what the insurance company is doing is from the very beginning, they're seeing how much money is being spent on the drugs. And they essentially will stop everything once that number gets to $4,020 during the year. At this point, they say, okay, we've been paying a lot of money towards the cost of that drug. You may have been only paying $10 for a small amount of time. What we're going to do now is we're going to go to stage 3, which is called the coverage gap. Also called the donut hole. When somebody is in the donut hole, essentially what's happened is that the insurance company has been spending a lot of money on the medications. If we're looking, they're spending the majority of that $100. They're now asking the insured to come out of pocket a little bit more. In 2020 and beyond, that amount will be 25% of the total cost of the drug. In our example here, our $100 example, that means the new payment for that drug to you, the insured, would be $25. Not so bad when it's a $100 medication. However, what if it's a $1,000 medication or a $2,000 medication? You can see how costs would get out of hand pretty quickly. In order to get out of this coverage gap or this donut hole stage, the next thing that the insurance company does is they go back through to the beginning of the year and they look to see how much money you personally, the insured, has come out of pocket to spend on medications. Basically, they're just looking at how much money has been spent by anybody other than themselves throughout the year. That would include anywhere up to your deductible that you've come out of pocket for, any of your tiered medications that you've come out of pocket on your copays, and any amount that you spent during the coverage gap phase. Once your total spend reaches $6,350, you are now considered out of the donut hole and on to stage 4. I generally like to look at this $6,350 as more or less a maximum out of pocket, a maximum amount that you're going to be spending on your medications in a given year. It's not totally true because there is some spending during the stage 4, which is called your catastrophic. But it will be considerably less. And what I mean by that is this. If the medication you are taking is a generic medication, you are looking at paying less than $3.60 for a fill of that medication on a monthly basis for the remainder of the year. If you're taking a branded medication, then your cost is going to be less than $8.95 for that month-long prescription of that medication. They say that, or it will be 5% of the total cost of the drug if whichever of those two is higher. But the bottom line is that you're saving the cost for those medications is significantly less than what you've been paying through many of the other phases of a drug plan. This is essentially how all drug plans work, regardless of what company sells them, what other deals they may have to them. This is the basics of how all drug plans work, where that donut hole comes from. And if you'd like to know a little bit about how to skip over all 3 of these stages here and move right to stage 4, there is a federal program called the Extra Help Program that's out there administered by Social Security that is easily applied for if you meet certain income and asset requirements. If you need any help with doing that, I encourage you to reach out to us. We'll be happy to help you go through that process and see if we can help save you some money on your medications throughout the year. If there's any other questions about 2020 Medicare prescription drug plans, I also encourage you to reach out to us. We're happy to help at any time. And thanks for your time.